Assalamu alaikum. I'm Nida Arbab. I'm working in Northwest General Hospital. In our live session today, we will discuss about COVID-19 introduction. I'll be introducing my guest. She is Dr. Aisha Mufti, MBBS, MED, FCPS, and CCM Critical Care. Assalamu alaikum, doctor. How are you?
I'm fine, thank you.
As we all know that it's a pandemic, a coronavirus pandemic. So would you please be kind and introduce this virus to me? What is it and why is it so talk of the town?
Coronavirus actually is a virus that causes diseases in humans. There have been multiple epidemics previously as well. Two of them are very well known. One was MERS and Middle East Respiratory Syndrome, and the second one was SARS. And the Middle East one was spread actually through camels, and then we had SARS, and this is the third one. Problem with this one is that it has spread almost all over the world. And although the mortality is comparatively less than the previous two viruses, but since the spread is too much, that is why we are seeing a lot of people unfortunately dying from the virus.
Right. Why is this disease being called COVID-19 or Corona 2019?
Actually, it's a short form. Corona stands, CO stands for corona, VI is basically virus, and the D stands for disease. Right. And 2019 is the year in which we had this outbreak.
Right. Why is this virus so efficient in being spreading? And as you know, the rates are increasing day by day. So why is this virus so efficient than other viruses?
The viruses, they have got different properties. I mean, they can survive on hard surfaces, and this virus is basically spread is more through respiratory secretions and also through contact. Right. It has spread more than the previous two viruses. The spread is more than the others.
Right. Who is at a very high risk of getting infected from this virus? Like which age group or categories of people who are at more risk?
Everybody can get the infection, although the disease is more severe in people with certain medical conditions and in elderly. Right. But everybody can get infected.
Okay. How do this virus spread?
It spreads through respiratory droplets as much as the research has come up with the ways with which it spreads. Although the research is not complete yet, they still are coming across new information about the virus, but it is known to spread through respiratory droplets, through sneezing and coughing, and also on the surfaces on which these respiratory droplets spread. That is the primary mode of spread.
Right. How can we protect ourselves?
Basically, what we should do is social distancing, keep the distance from people, wear mask whenever you go out, meticulous hand hygiene, always use hand sanitizers, wash your hands, and stay away from people who are sick, who have respiratory symptoms, and keep yourself away from elderly if you have respiratory symptoms.
Okay, what should I do if I've had a close contact with someone who was later on diagnosed as positive? So what should I do?
First thing is that you should isolate yourself. Right. The exact term that they use for a person who has come across a patient but has not developed symptoms yet is quarantine. You do get quarantined and check your temperature twice a day.
Right.
So that is it.
When should I get emergency care if I develop symptoms? When should I go to the hospital?
When you start feeling respiratory difficulty, that is the time when you should contact a doctor, because most of the patients, they develop mild symptoms and they recover completely at home. Right. So that would be the time when you start feeling shortness of breath. That is the time when you should consult doctor.
Right. What kind of people, what category or what underlying medical conditions people get this virus in a severe form? Like usually the symptoms are mild, but when does it get severe?
Most of the patients that we have seen usually have an underlying health problem, like they are diabetic or they are hypertensive or they have heart disease, or obese patients, and the one with respiratory problems. But almost anyone can get it. But these are the category of the patients in which you get a severe disease.
Okay, so is it safe to get care of my other medical conditions during the time?
Yes, it is safe and necessary. You should get care of the rest of the diseases that you have. If you're having hypertension, you should continue the treatment for that. If there's diabetes, then you should continue treating that.
Right. How important is it for the kids to wear mask or have precautionary measures?
It's very important. Kids do not get severe diseases, but kids can carry it to others.
Right.
So this is extremely important, especially in homes where you have elderly. Then you should make your kids use all these precautions.
Right. What category of people should be wearing masks? Only health professionals or no, everyone?
Everyone needs a mask. Everyone needs to wear a mask.
Does that include children?
Yes, that includes children.
Right. What are the common symptoms? What are the common complications of COVID-19?
Symptoms usually they develop fevers and generalized body aches and pains and severe lethargy, weakness and sore throat. Usually they don't have any runny nose. They can have some mild nasal congestion. They can have headache. And the severe disease, you get start having dyspnea, respiratory difficulty. The cough usually is dry, and cough and respiratory problems usually develop after 7 days of the initial illness.
Right. Are the symptoms of COVID-19 different in children than in adults?
Children develop more GI problems, but they can also have this cough and sore throat. And
right. How should I prepare myself and my family to stay safe from COVID-19?
Unnecessarily going out should not be done, and family should wear mask whenever they go out. They should use those SOPs that have been developed by the government of Pakistan to prevent the spread. And obviously hand hygiene is important.
Right. Is it possible to have flu and COVID-19 together?
Yes, it's possible to have two diseases at the same time.
Right. Would that be any different from COVID-19 only symptoms or no?
In flu, usually people have more runny nose and more upper respiratory symptoms. COVID usually presents with dry cough and high-grade fever and sore throat. So yes, you can, in flu you will have more upper respiratory problems.
Right. What kinds of test can I get for the diagnosis of COVID-19?
The diagnosis is done by a PCR. There is no other test. The antibodies are only, they will only tell you that you had the infection sometime in the recent past. But for the diagnosis in acute disease, you will need a PCR.
Right. Last question. Do you think if once a person is infected and after that it means they are immune to the problem, to the virus?
So far, this has not been proven.
Right.
People, the recent studies that I was seeing, the antibodies that develop usually last for a few months only.
Right.
So the research is still in progress, but we don't know, we don't have the complete information about it. So I would say yes, people can get a reinfection with it.
Right. Thank you so very much. That's all for today's session. This is all from today. Thank you so very much. Stay home, stay safe. Together we can.